Hello, I am Dr. Joseph Isaac, former assistant professor of clinical psychology and writer of 4 books on psychological treatment. In the very outset, before I delve deep into the main theme of my talk today, let me recapitulate before you my earlier arguments in my previous talks to refresh your memory and make you live in spirit. Argument number 1. Human brain and human mind are both totally different manifestations of reality in the universe. Brain is a lump of meat in the skull, in the human body, manifested in the particle form, and mind is a spread out wave not produced by the brain, but it is suffused everywhere in the entire universe, and hence I would say that mind is non-local. Argument number 2. The present equation fooling the entire world that the brain is the mind is nothing but cheating the public and spreading Himalayan lies in the name of science to promote drug interests and not to serve people's health interests. Argument number 3. In actual reality, as we empirically understand, mind and brain are not the same in epistemological status. Thus, it necessarily follows that the disorders of the brain are absolutely not disorders of the mind. Thus, it necessarily follows that the disorders of the brain are absolutely not disorders of the mind. Viewing the brain meat as the mind creates a type of psychic blindness or maya or illusion in the minds of people and closes the doors of perception and growth of materialism, denounced and declared dead by quantum physics. Now I am coming back specifically to my topic for discussion today. The topic is, can neurotransmitters of the brain be tested for detecting depression or other mental disorders? To this question, I would answer a definite no, because neurotransmitters are tiny subatomic chemical molecules that are not readily visible to our human eye, which can easily be detected in a psychiatric interview and cannot be tested in the ordinary laboratory directly from the blood or urine. I fervently hope that the authentic information I am going to present here will clear your doubts regarding the exaggerated speculations or guesswork about the neurotransmitter involvement preponderant in the mental health field. As you can very well imagine, examining a chemical particle invisible to our eye involves high amount of uncertainty for our easy observation because the orbitals occupied by electrons cannot be located with high precision. Orbitals are based on probability distributions for an electron. It is simply impossible to determine with high accuracy both the momentum and position of an electron simultaneously. Heisenberg's uncertainty principle in quantum physics is applicable to neurotransmissions also because they are tiny particles and it can be identified only with imprecision in research laboratories. Heisenberg, the Nobel Prize winning quantum physicist who revolutionized physics by dematerializing the universe, by his quantum mechanics and by his uncertainty principle, had clearly described the meaninglessness of observing such quantum particles with scientific precision. Uncertainty principles posits that we can never understand all that is required about the status of a quantum particle. If we can understand the position of a particle, then it is not possible to understand exactly its velocity. Likewise, if we understand exactly the velocity, we cannot precisely estimate where its position is. Hence, measurement of such particles becomes inevitably indeterminate. So, the exact position of quantum particles in the membrane of neuroreceptors and the accurate velocity of the passage of particles through the holes in the membranes will have its impetus on the excitation or inhibition of the neuronal cells. Erwin Schrödinger, the Nobel Prize winning physicist and the founder of quantum wave mechanics equation, in his famous book Science, Theory and Man, has made this very clear. Within quotes, all chemical transformations, the velocity of chemical reactions and their variation according to temperature, the process of melting and evaporation, the loss of vapor pressure, etc. Everything, in fact, with the possible exception of gravitation, is governed by the laws of this kind, and all the predictions derived from these laws are of statistical nature and are true only within limits. Close quotes, page number 66. Dr. Schrödinger, while explaining the behavior of particles, has also added, most relevantly, in the following manner, within quotes, a competent theoretical investigation a competent theoretical investigation of the collision of two particles, whether of the same or of different kind, has to take account of their wave nature. The results are duly applied to the collisions of cosmic ray particles with atomic nuclei in the atmosphere, both being extremely rare feed in every sense of the word. But perhaps this is trivial. It only means that even an isolated particle which gives us the illusion of transitory individuality must yet not be likened to a classical particle. It remains subject to the uncertainty relation, all of which the only intolerable image is the guiding wave group, close quotes, page number 220. When the subatomic world is governed, when the subatomic world is governed thus by high uncertainty, and the behavior of chemicals in the quantum world is primarily probabilistic in nature, as great scientists Heisenberg and Schrödinger had proved. Talking with certainty about the neurotransmitters causing depression or determining moods appear to be silly and funny. Only gullible people believe in this nonsense. Therefore, I firmly believe those who claim and propagate the theory that depression is caused by serotonin imbalance have deliberately cooked this theory and deliberately invented it in their imagination and then exported it to all people with the intention of promoting and selling psychiatric drugs. This blatant lie is fooling the entire world. Even educated physicians believe in this. And this wrong belief is causing great health hazards and drug addiction. Psychiatry is unleashing an epidemic of drug addiction. If any patient says that he is benefited by Prozac consumption, that means the improvement is due to psychological reasons and not physical reasons. I call this psychological improvement placebo effect. That is, when your mind believes in something, or when your mind believes that a drug is helping you, it creates biological and neurological changes due to positive expectations and positive imageries. The biology and psychology of belief, that is exactly we call the mind acting over matter. Mind acting over the material body is well explained in the science of psychosomatic medicine. When Prozac, an antidepressant drug that is included in the group of drugs technically known as selective serotonin reuptake inhibitors or SSRIs was sold in the market sparingly with the permission of the Food and Drug Administration, the FDA, proclaiming that Prozac is a magic drug or wonder drug or miracle cure or embrace drug for balancing serotonin in the brain. Gullible people believe that it is true. Majority of the people with emotional problems believed that it is true and considered that this is a medical solution for their mental agonies. They welcomed it with great hope and found solace in this false claim, thinking that it will change their brain. Serotonin is a neurotransmitter, a chemical produced in nerve cells. There is absolutely, I would say absolutely, no evidence, no scientific evidence to confirm that depression is created by an imbalance in serotonin. There is absolutely no conventional blood or urine test that directly reveal to you the levels of neurotransmitter in your brain, especially serotonin. It should be remembered that even testing blood to know the level of serotonin is nothing but a futile attempt because it is well known that serotonin does not cross the blood-brain barrier. Serotonin does not cross the blood-brain barrier. What does blood-brain barrier technically mean? Blood-brain barrier is a selective semi-permeable membrane barrier that bifurcates the circulating blood from the brain and extracellular fluid in the central nervous system. The blood-brain barrier is made by brain endothelial cells, and it allows the passage of water, some gases, and lipid-soluble molecules by passive diffusion, as well as the selective transport of molecules such as glucose and amino acids that are important to neuronal functioning. Here, I would like to invite your attention to another crucial factor which requires great consideration. The question whether a person's serotonin level is low or high is highly immaterial in regard to a person's emotional well-being or depression. Depression is an emotional experience or a non-material software change in the thought wavelength and thought frequencies in the mind. It has nothing to do with the brain meat. It has nothing to do with the brain meat. Your brain is only like a radio receiver or television set that receives the programming of the mind. Mind programs the brain and the body obeys it. Mind over matter. Mind over matter. Even if you establish that there is low serotonin in the blood, nobody can establish a causal connection between depression and serotonin. The great error our mind makes in coming to conclusions is that we confuse We confuse correlations of symptoms as causations. In fact, correlations are not causations. Dr. Joseph Glenmullen, a clinical instructor in psychiatry at Harvard Medical School, USA, in his famous book, Prozac Backlash, has criticized the chemical imbalance theory in psychiatry very meaningfully in the following way. Within quotes, psychiatry is unique among medical specialties in that all of its diagnoses are merely syndromes, clusters of symptoms presumed to be related, not diseases. We do not yet have proof either of the cause or the physiology for any psychiatric diagnosis. This is why the official names for psychiatric diagnosis This is why the official names for psychiatric diagnosis in the American Psychiatric Association's Diagnostic and Statistical Manual, DSM, uses the term disorder. Here, the word disorder is being used for a syndrome. The diagnoses are called disorders because none of them are established diseases. We do not have yet a major depressive disease or even a manic depressive disease. In recent decades, we have had no shortage of alleged biochemical imbalances. In recent decades, we have had no shortage of alleged biochemical imbalances for psychiatric conditions. Diligent though these attempts have been, not one has been proven. Patients are often explicitly told that they have such a disease, usually to justify treating them with medication. A serotonin deficiency for depression has not been found. Close quotes, page number 195 to 197. Prozac Backlash. In his book, Prozac Backlash, Overcoming the Dangers of Prozac, Zoloft, Paxil, and other antidepressants with safe, effective alternatives. Thank you very much.